2020's iGEM project. We're very excited to deliver this to you, and I hope you guys enjoy the presentation. So what are we doing? Our team is working on developing an innovative therapeutic to delay the progression of neurodegenerative diseases, such as Alzheimer's and Parkinson's. And to do this, we're going to engineer the gut colonizing bacterium Clostridium sporogenes to secrete ketone bodies for absorption into the bloodstream. We're designing this bacterium to give it the ability to colonize part of the human digestive tract, specifically in the colon, as part of the human gut microbiome. And we're going to engineer a butyrate pathway into this Clostridium strain. And hopefully in the event of increasing the concentration of a ketone body called DBHB. These secreted ketone bodies in the bloodstream will then cross the blood-brain barrier, and they are shown to have a beneficial effect on neurons in the brain. And this has got improvements in cognitive benefits and mobility and slowing down neuron degeneration. What inspired us to think of this? Well, neurodegenerative diseases are a massive issue in this day and age, especially with our increasing aging population around the world. In 2019, just last year, over 750,000 people were diagnosed with dementia and 120,000 more with Parkinson's. Obviously, there's a whole host of neurodegenerative diseases such as Alzheimer's, Huntington's, or motor neurone disease, and Parkinson's is just one of those. This represents a large proportion of the population that will either be diagnosed or affected by a neurodegenerative disorder. Obviously, it's not just the sufferer, the patient that suffers here, it's their family, whether they become carers and there's the total effect on society and having to care for an aging population that are suffering from many debilitating issues. Currently, the treatments focus on alleviating symptoms rather than treating the disease. There is no cure for Parkinson's at the moment, but one of the most popular treatments is to use a drug called levodopa, which acts as a precursor to dopamine, and this in turn increases brain activity, and because it's a neurotransmitter in the brain. So at the moment, this is the most common treatment that we see. It's more of a reactive treatment rather than something proactive. And this is where we come in, and we would like to, This is where we'd like to start to tackle neuroprotection before the damage has occurred. Because at the moment, when the diagnosis of Parkinson's, for example, occurs, the damage has already been done. It's almost too late. It's irreversible pretty much. And as you can see there, 50% of the neurons in the substantia nigra, which is a part of the brain, are already destroyed. And the effects are, because the effects happen so late in life, the disease has already moved on to such a devastating stage. We hope that our therapeutic will be present in the gut, and it will have an effect on the brain despite its location within the gut. And this is making use of the gut-brain axis, which is something that has come up in recent years. It's the effect of the gut microbiome on the brain and the rest of the body. And we think that there's a lot of potential in utilizing that. The fascination of the gut and brain axis is what spurred us on to further developing our project and to designing a biotherapeutic. With the support and expertise of our supervisors, we decided to use Clostridium sporogenes, as they are SBRC, Synthetic Biology Research Council in Nottingham, pretty much experts on Clostridium. So we're very lucky to be working with them and to be able to make use of their expertise and guidance. Last year, the 2019 Nottingham team also worked on Clostridium sporogenes. So we've been able to make use of work that they've done prior to ours and build on top of that. And we've been in contact with the previous year's team as well, and they've been very helpful to us. In terms of modelling, obviously this year, it's been hard to get into the labs for us in particular. It's impossible. It was a decision made very early on that this would be a dry lab project. So this means that modelling has become a crucial part of our project. And part of this is simulating the bacteria, the growth of the bacteria in the gut, and by using structural and dynamic modeling, in particular Python and MATLAB as our softwares. The goal with this is to determine the yield of our secretion of our ketone bodies, called DBHB, and the required dosage that we will need to dosage humans. And this will have an impact on the rest of our project, from administration, which I'm working on in particular. And it's very important. Computational modeling, MATLAB in particular, will help us observe the levels of products produced from various reaction rates, and adjusting the parameters of these reactions and models will allow us to influence production of a certain product X, or if we prefer another product. By using Python, we can verify the model, and by using mass balancing, which is very, very hard work, it allows for the limitation of outflow and inflow of products and reactants in an effort to observe the changes on the growth rate of our culture, our biotherapeutic within the gut. That's all I have for now. I wanted to keep it quite short and quick. So be sure to check us out on Instagram at Nottingham iGEM, or Twitter is the same. We've also got YouTube videos coming up on iGEM Nottingham. Check us out on Facebook as well. And we will be releasing our podcast, which we have been very excited to record over the last few weeks, on Spotify and Apple Music soon. So keep an eye out for those. Thank you. I'll stop sharing now.
That was really great and informative. Thank you for sharing that with us.
Thank you.
So my first question is, where do you see this project, since right now it's in a dry lab development, where do you see this project moving towards the future, as far as continuing to build upon as you have from other teams?
In the future, it would be nice if we could create a real product. We've seen the EPIC program for entrepreneurship for iGEM teams, and that would be ideal. But unfortunately, we think it may be a step too far in terms of lab time and efforts. This Nottingham like to run a 1-year program, as we like to get as many people involved with iGEM as possible. So possibly if we had a 2-year phased project, then maybe we could think about producing it in real life, or manufacturing spores of sporogenes and engineering this. But unfortunately for now, purely theoretical, hypothetical.
Okay. And you mentioned that you are incorporating a butyrate metabolism for the production of the ketone bodies. Can you tell us a little bit more about that?
Yeah, so the butyrate pathway has been identified by many researchers. It has a lot of beneficial effects. There are a lot of molecules that are secreted through this pathway, such as butyrate, obviously the butyrate pathway, but there's a lot of side products as well, ketone bodies in particular. Acetoacetate, acetyl-CoA is also produced in this pathway, which is one of the main effects of this reaction. And DBHB, which is beta hydroxybutyrate, D form, the D isomer of this molecule, which has been shown to have a beneficial effect, ketone bodies in particular. So yeah.
So thank you for answering that. So also, this bacteria would be in the gut. So are there any challenges as far as maintaining the population of that bacteria in the human gut so that it can continue to produce these ketone bodies?
That's a very good question, actually. We've been tackling that over our project. Is one of the questions that we've had to deal with, whether or not we will go down the colonizing route of taking bacteria that will colonize in the gut and easily reproduce, so we know that it will be able to stay there, or as a control measure, whether we'd like to use a non-colonizer that will pass through the gut, but in the process of passing through, it will still have time to multiply and reproduce, and still hopefully producing this effect. So from a control point of view, a non-colonizer may be preferred. And we have had talks with, in particular, our human practice side have done very well. We've managed to talk to a biotech company in Nottingham called Chain Biotech. We talked to a man called Dr. Ed Green, and he is producing a very similar idea in terms of us, but they've decided to go down the route of a non-colonizer, pretty much for that reason, so it's easy to control.
All right. Well, thank you so much for answering my questions. I think that just about wraps up our interview. Is there anything else you'd like our audience to know about your project?
Just stay tuned. We've got a lot to release on our socials. We've got a little project coming out in the next few days, a Minecraft project for our outreach side. And we'd like people to get involved with that. We're particularly aiming at high school kids potentially, and we're very excited for that. So yeah, stay tuned, guys.
Okay, well, just a reminder, Nottingham iGEM is in our competition for sponsorship from Molecular Cloud and GenScript. So make sure you vote for their project, and good luck in the iGEM Jamboree.
Thank you very much.